People who have social anxiety worry that others will judge them for being socially awkward or think badly of themselves, or that they'll embarrass themselves. I'm Andrea Brognano, and I'm a licensed mental health clinician specializing in anxiety disorders. And here's a quick overview of social anxiety disorder. In this video, we'll discuss what is social anxiety versus shyness, social anxiety symptoms, recognizing common triggers, review the signs of social anxiety, and how to treat social anxiety. So what is social anxiety? Social anxiety disorder is a type of anxiety disorder where a person has a phobia or specific fear of social situations. In some cases, people with social phobias fear specific types of social activities like dates, parties, or large crowds, while other people become anxious in almost all social interactions. For some people, talking on the phone, attending classes, or just seeing friends can trigger some sort of social anxiety. Social anxiety versus shyness. People who are introverted or shy may be more likely to experience social anxiety, but this doesn't mean that they have a diagnosable social phobia. Experiencing anxiety in social situations is a fairly normal, even for people who aren't shy or introverted. The difference between normal shyness and social phobia is that phobias cause excessive anxiety that involve a lot of distress, and they often lead to avoidant behavior that interferes with a person's ability to function. Let's go over some symptoms of social anxiety. The key symptom of social anxiety is fear or avoidance when facing a social situation that has lasted for at least 6 months, but the exact manifestations of the condition can look a bit different for everyone. Emotional and behavioral symptoms of social anxiety include significant fear of one or more social situations in which the person is exposed to possible scrutiny by others, fear or embarrassment that other people will notice symptoms of anxiety. Exposure to social situations almost always causes intense anxiety, which may escalate to a panic attack. A recognition that fear is irrational or excessive, avoidance of feared situations or extreme distress when they're not avoided, or the anxiety and or resulting avoidance leads to an interference in normal routine, functioning, social activities, or relationships, or it leads to marked distress. Some physical symptoms of social anxiety might include shortness of breath, blushing, feeling dizzy, sweating, profuse sweat or sweaty palms, heart palpitations, rigid body posture, muscle tension, nausea or feeling a knot in the stomach, zoning out or having a blank stare, or speaking with a very low tone or stumbling over one's words. Some avoidance symptoms of social anxiety might include refusing to go to school or missing work, not attending a social gathering or party, staying away from places where there are a lot of people, reluctant to meet new people or initiate conversations, avoiding eye contact in conversations, diverting attention from themselves to others, avoiding using public bathrooms when others may be present, not eating, drinking, writing, or pointing in public for fear of trembling hands, not shaking a person's hand or eating spicy foods because there's a fear of sweating, averse to places with bright lights, or discussing intimate topics because of fear of blushing. So what triggers social anxiety? People with social phobias often experience anxiety in more than one situation, but sometimes anxiety triggers depending on the unique experience in their routine or even negative or embarrassing experiences they may have had in the past. Social anxiety can also vary from day to day, with certain surroundings, circumstances, or other stressors influencing the level of social anxiety. Some situations and circumstances that can trigger social anxiety include large social gatherings, events or parties, being the center of attention, introductions or meetings of other people for the first time, interacting with authority figures, physical signs of embarrassment like blushing or shaking, having to speak or perform in front of others, having to eat or drink in front of others, dating and romantic interactions, receiving compliments or praise, being asked questions, having to engage in small talk, basic interactions like making an appointment or placing an order, giving or receiving constructive feedback, or confrontation or difficult conversations. Types of social anxiety disorders include people with social anxiety disorder may fear different types of interactions and situations. Some people will develop anxiety in any social setting, including when they are around people that they know very well. Some people develop anxiety in other situations. Others might only experience social anxiety around people they don't know well, or when they're in large groups of people. Others may experience social anxiety that is setting specific, such as people who are afraid of party settings, work settings, or being in crowded places. There are 4 types of social anxiety. Performance anxiety, or stage fright, can occur in any situation where a person must speak, talk, or complete a task. Glossophobia is a fear of public speaking. Agoraphobia means having a specific fear of being in certain public places, like sitting next to someone on a plane. Panic disorder is something that some people with social anxiety disorder also experience with panic attacks. When panic attacks are regular, sometimes people develop a separate anxiety disorder known as panic disorder. So what causes social anxiety? A combination of environmental, biological, and psychological factors place some people at a higher risk than others for developing social anxiety disorder. Certain factors are known to increase risk for almost any mental health, trauma, lack of support system, or having an existing mental health or substance use disorder. Social anxiety treatment. Treatment for social anxiety might include medication, therapy, or a combination of the two. Therapy is considered a frontline treatment for social anxiety, as it carries fewer risks than certain anxiety medications. Anxiety therapy helps people learn skills to manage their symptoms and reduce avoidant behaviors, improving their overall level of functioning. Social phobias is highly treatable, and many people with disorder respond well to therapy. Some common types of therapy for social anxiety include cognitive behavioral therapy, or CBT. This helps people notice, interrupt, and change unhelpful thoughts that feed into their anxiety. Exposure therapy is a specific kind of CBT that involves exposure, where a person gradually faces feared situations, resulting in desensitization, less avoidance, and more confidence. Acceptance and commitment therapy, or ACT, involves the use of mindfulness skills to help people accept and respond differently to their anxiety. Group therapy is an option through which CBT groups for social anxiety have shown to decrease negative beliefs about oneself and being overly self-conscious. When using social anxiety medication, it's also sometimes recommended to have certain patients, normally in addition to counseling, use medications. The most common form of anti-anxiety medication prescribed are benzodiazepines, selective serotonin reuptake inhibitors, or SSRIs, and selective norepinephrine reuptake inhibitors, SNRIs. Medication is prescribed and monitored by a psychiatrist. There are various support groups that are available, and they're a great way to complement and extend professional treatments. But people with social anxiety may choose to stay away from these group settings. Entering a support group could be a part of someone's treatment plan that they could graduate to after the symptoms have been managed. No matter what form of treatment you decide to get, please be sure that you're choosing what's right for you.